We have always said that our guidance on masks is based on scientific advice and evidence. And that's why originally we started out by saying you only need to wear a mask if you are unwell. That is also the advice by the WHO. But we now are in a different situation because we are seeing new data, new information being put out, including evidence that infected persons with no symptoms may infect others, which means that you may not know whether you are well or unwell because an infected person may be carrying the virus but may well have no symptoms. And then even when they speak, droplets may spread, especially in close proximity to another person. That's why even the WHO and the US CDC are now reviewing their own guidelines. And similarly, we have been studying this for some time. And on top of the new evidence, we are also in a different situation in Singapore today than before. Before, we didn't have community spread of the virus. Now, we are seeing an increase in locally transmitted cases, and we are also concerned about possibly undetected carriers within our community. Right, so it's because of all of these reasons that we've decided the position on mask has to be updated, and now we have updated the guidance. We still want to conserve surgical masks for our healthcare workers because there is a global shortage of surgical masks. We are trying our best to replenish our supplies of these masks and also to build up some local capabilities, but still, these masks have to be conserved for our healthcare workers. That's essential because they do need them in order to care for their patients. But for the general population, some form of mask, even a reusable mask, can serve as a physical barrier and can provide some basic protection. And that's why our advisory now is, first of all, don't go out, stay at home. But if you have to go out for essential activities and you cannot avoid close contact with others, that's the key. If you cannot avoid close contact with others, then wear a mask. And even there, in such circumstances, a reusable mask can offer some protection. So that's the thinking behind this change in guidance. On your other question, could we have put in place the measures earlier? In the end, it is a judgment call based on the global and local situation. Certainly, we could have done this very much earlier, but there is also a concern from medical experts and public health experts looking at all of these safe distancing measures, mitigation, the safe distancing measures that we're referring to. If you were to put them in place too early, there may well be fatigue. And when there is fatigue, people may not abide by the measures so well, and then they will not have their intended effect. So there is a case to think about when to implement them and to ensure that we implement them at the right time. Right? For example, if we have put in place all the measures that we're talking about now, and we have put them in place much earlier, we may very well still be in the same situation today, with the measures in place 3 months later, right? And children will be no longer will be out, will not have schools for 3 months, even longer. So you have to decide. If you do it too early, there may be fatigue. There will be significant disruption to people's lives, and in the end, it may well be counterproductive. Even the timing that we have decided now, if you look at what other countries have done, we are doing this relatively early in our infection cycle. We have not reached a point where we are seeing many uncontrollable outbreaks, right? We are still in a phase where we are containing the virus. Many countries have moved to this set of measures that we have just announced only after giving up and abandoning containment, and then they decide, well, let's all go into this, stay-at-home orders. We have not given up on containment. In fact, we are still going all out to detect and contact trace every case, quarantine the close contacts, and try and stamp out every infected cluster. We are pursuing containment, but at the same time, we think it's necessary to do more with safe distancing, and that's why we are putting in place these new stringent set of circuit breakers in place, and both the contact tracing, the safe distancing work in parallel, and we have then a best chance of trying to control the spread of the virus. Finally, your question on Singapore pools and I think 4D outlets, they will be closed. They are not considered essential services.